Hello everyone, my name is Mario Barrera, and today I'm going to be going over the major muscles of the anterior and posterior that we'll be learning for 201 and 210. Alright, hello everyone. Just starting off, we're going to go ahead and identify some of the muscles of the face. So there's a lot of muscles kind of going on with the face. The easiest way to identify them is just to kind of notice the striations and the directions that each muscle fibers are going. So you can tell kind of in the general area of like what muscles you need to identify. So first up, we have the mentalis muscle right along here. That's the tip of the chin. So the mentalis muscle, if you think back to your lab 1, the mental region kind of referred to the tip of your chin. So mentalis, it just kind of makes sense because it's in that region. It's named after that region. Next up, for our mouth, we have the orbicularis oris. Orbicularis kind of refers to like the circular motion, kind of curving along. Comes all the way around your lips, orbicularis oris. And another circular muscle that we have on the face is the orbicularis oculi. It's going to be bilaterally, but we only have half the face to work with. So our orbicularis oculi is the one kind of revolving around the eyelid, right along here. Additionally, we also have the zygomaticus major. It's going to be coming on the outer area. It's going to be more inferior compared to its minor counterpart. The zygomaticus major is going to be inserting into the angle of the mouth. It's going to be originating from the zygomatico-temporal joint. Further inward, kind of coming along here, is our zygomaticus minor. It's going to be inserting around the same area that our zygomaticus major is, but it's going to be coming up much more superiorly. Additionally, one of our muscles of mastication, known as our masseter, is going to have these vertical striations along the outer edge. You should definitely be able to see this on the cadaver. It's very easily identifiable. Next up, we have the buccinator, which is going to be much deeper, and its striations are actually going to be going in the complete perpendicular plane compared to the masseter. So our buccinator is going to be going from left to right, or like horizontally. Next up on the neck, we also have our sternocleidoid mastoid muscle, a very large neck muscle, kind of originating from our sternum. And it's kind of headed back to our mastoid process, as well as a few additional bony landmarks on the back of our head. Very large muscle right along here. On the cadavers, it's actually reflected, so you can actually peel the muscle back up. That's kind of the easy way to identify it on the muscle. Underneath, there's a few different muscles you're gonna have to know right along here. The mylohyoid muscle is gonna be basically forming the mouth, or the bottom of the mouth. Right along here, it's gonna be deep into here. Next up, you need to know your digastric muscle. So again, your digastric muscles are actually going to be bilateral on both sides. Label number 64 here, you can actually see our digastric muscle. All right, we're good. All right, so one additional muscle I forgot to mention earlier was the frontalis muscle. So you're actually going to be able to see the frontalis right along the top of your frontal bone. They share the same name, so it should be another common muscle, easy muscle to kind of memorize. Next up, we're going to go over some of the neck muscles deeper in here. So first up, another muscle of mastication is going to be our temporalis muscle. It's going to take up this huge temporal fossa area. On the cadavers, it should actually be reflected on one of the sides. You can actually see the tendons actually insert deep to the zygomatic arch back here. Next up, we have our sternothyroid, sternohyoid, and thyrohyoid. So these names might sound a little complicated at first. Trust me, I'm going to show you. It's really easy to kind of memorize these guys. So right on top, this number right here, it looks like 56. Is going to be the sternohyoid. The sterno refers to the manubrium that it's attached to, and the hyoid bone that's coming up here. So sternohyoid connects to the sternum and the hyoid bone. So sternothyroid connects from the sternum to the thyroid cartilage, kind of back here. It's a little bit harder to see, but our muscle is going to be deep back here, and it's going to be our sternothyroid muscle. And then our thyrohyoid muscle is going to be the deepest in here, and it's just attached to the hyoid bone and the thyroid cartilage. So again, sternohyoid, sternothyroid, and thyrohyoid. Okay, perfect. So one additional muscle that I forgot to mention in the neck region, it may or may not be on your terms list, you may or may not be required to know it. I thought I would just mention it because it's a pretty common muscle as well, is the omohyoid, which is attached here, right here in the posterior triangle. Label number 55, it looks like. Omohyoid, so if we break down that word, it attaches to the hyoid bone, and the omo, which is kind of like on the posterior side, back in the scapula region. Omohyoid. All right, next up, we have a few anterior chest muscles that we're gonna go ahead and take a look at. Right along here is our pectoralis major, a very prominent muscle, very easy to identify. On the opposite side, it's actually reflected, taken off, so that you can actually see what's deep to the pectoralis major. Is going to be our pectoralis minor right here, along with its insertion points, our origin insertion points. Along the lateral side, you're actually going to see the serratus anterior running along the lateral side of the body. And then coming over here, you're going to actually see the external intercostal muscles, external meaning on the outer side, and the internal intercostal muscles, internal meaning more medial. And again, looking at the striations of the directions, you can see 3 and 4 are running in opposite directions. That's how you're able to identify when our intercostal muscles are different, when they start, when they end, that kind of stuff. All right, so now we're going over some of the posterior muscles. First up, 2 of our largest muscles on the back are going to be our trapezius muscle, kind of stretching out over here. This muscle is involved in a lot of different actions because of its different multiple origin and insertion points. Beneath it, we have the longissimus dorsi, stretching all the way over. It actually inserts back over here onto our arm of the latissimus, onto the intertubercular sulcus of the humerus. Deep to these muscles, we're actually looking at a little bit harder to identify some of these muscles. Here is our semispinalis muscle. We have our splenus capitis muscle and our splenus cervicis muscle, as well as our levitator scapulae. So if we want to go over this, splenus capitis, I always remember it just as the angle that it's kind of coming at. These striations that are kind of going at a more oblique angle. Our semispinalis muscle is kind of going more vertical, so I think of more vertical like the spine, semispinalis. Our levitator scapulae is actually inserting onto our scaphoid, or not a scaphoid, our scapula, which makes me think of as an upper extremity muscle. It's a lot easier to identify. And our splenus cervicis is just going to be a much deeper muscle, kind of supporting the splenus capitis. We also have our rhomboids major and minor. So it's easy to identify our rhomboids major and minor by taking a look at its insertion point. So the minor is on top, it's superior. It's actually going to insert onto the scapula above the spine of the scapula. And then the major is inserting onto the scapula right beneath it. So rhomboid minor, rhomboid major. Our erector spinae muscles, you can memorize them going from lateral to medial or medial to lateral. That's just the easiest way to go about it. One acronym is like she loves ice cream. So the she and she loves ice cream is actually going to be our spinalis muscle. So spinalis is closest to the spine. Next up, we have our longissimus muscle, kind of going straight up, a little bit more lateral. And then our iliocostalis muscle on the most lateral side. Perfect. So we have to go over a few abdominal muscles as well. There's just 4 of them, so they're pretty easy to memorize. First up, we have our external abdominal obliques. They're coming in from that oblique angle. They're going to be the most superficial muscle. And the striations are coming basically inside of what's known as the pocket. Next up, the rectus abdominis is actually going to be deep to the fascia, the rectus sheath that's actually covering the abdominal wall of the cadaver. The rectus abdominis is going to be a very vertical, straight and up and down muscle, very easy to identify again. Next over here, we have our internal obliques, which is going in the opposite direction here of our external obliques. Because both, like, you know, the external obliques is going to be going in this way, internal obliques is going to be going in the opposite direction. Since it's on the other side of the linea alba, they're actually going in the opposite direction. And then on the bottom here, we have our transverse abdominis muscle. It's just going completely horizontal, perpendicular to the rectus abdominis. All right, next up is going to be our upper extremity guy. So first up, largest muscle on here is our deltoid. Our deltoid is going to make that triangular shape on our shoulder. Very easy to identify just because it's that triangular shape. So again, deltoid, like in the Greek alphabet, deltoid is a little triangle that you can draw out. So same kind of concept. So I'm gonna go ahead and remove the deltoid so we can get a look at some of the deeper muscles going on here. If I can remove it, there we go. All right, so first up to know is our rotator cuff muscles. These are very important for the multi-axial plane that our shoulder moves in. So the rotator cuff muscles are mostly remembered as the acronym SITS, S-I-T-S. So first up, the first S is gonna be our supraspinatus muscle. That resides within the supraspinatus fossa along the top of the scapula. The I stands for the infraspinatus, which is going to be number 11 marked here. Infraspinatus is going to be all along here. The T is going to be for the teres minor. That's going to be number 12, kind of sticking out under here. You can tell this is the teres minor versus the teres major because the teres minor actually inserts with the rest of the rotator cuff muscles. You can just follow its tendons along there. The teres major is going to be inferior to the teres minor. And then the final S is our subscapularis muscle, which is going to be in the subscapular fossa on the anterior side of the scapula. Moving on to the brachium, we have our biceps brachii. So it's really easy to remember. Biceps means two-headed. Brachii just kind of refers to the general region. So our biceps brachii, it's going to be right along here. We can actually remove this guy as well. To identify our second muscle in the brachium is our brachialis muscle. This is kind of the powerhouse. This is where most of the flexion of the arm is going to be occurring, along with a few other actions. Running along the skinnier side, this muscle is going to be a lot smaller, even on the cadaver. It's going to be our coracobrachialis, number 17, coming along here. Those are our three muscles in the brachium: is our biceps brachii, our brachialis, and our coracobrachialis. Now, flipping over here, we can actually take a look at the triceps. So our triceps, so that's tri, that means three-headed. Triceps is going to be all along here. It's going to be very bulky, but each muscle is, or each head is going to kind of have its own deviation. So really nice and easy to identify as well. Along on the backside again, we have our anconeus for our elbow. It's like inserted like right below our elbow, right along here. It's our anconeus. All right, next up, we're going to be identifying the muscles of the forearm, the main flexors of the hand, first up. So the easiest way to go about this is to go from lateral to medial and just kind of work in one direction or the other. Easiest way for me to obviously identify it is one of the major muscles, first off, is our brachioradialis muscle, very large muscle attaching to our lateral epicondyle back here. And then working our way more medially, we have our pronator teres. We have our flexor carpi radialis, which is more on the radial side rather than the ulnar. We have our palmaris longus. It's a very easily identifiable muscle because the tendon inserts directly into the palmar aponeurosis right over here. Coming along the side now, we have the flexor carpi ulnaris, and deep to the palmaris longus, we actually have a muscle known as the flexor digitorum superficialis, which is actually where all these tendons are kind of sprouting from and inserting onto the intermediate phalanx. Now, if we go ahead and remove this to go deep to it, we also have the flexor digitorum profundus, which is a much deeper muscle and it has tendons that insert all the way to the distal phalanx, all the way at the ends. Coming along the side now, on the back side, we have all of our extensor muscles. So first up, we have our extensor carpi radialis longus. Immediately after that, we have our extensor carpi radialis brevis. Coming back here now, we have, all right, just for some quick clarification, this guy right here is the abductor pollicis longus. This guy is the extensor pollicis brevis. And this long tendon coming down is the extensor pollicis longus. We will be able to see the actual belly deep inside here following the tendon. Back here, we have our extensor digitorum, which is the tendons for basically the majority of our digits back here. We have the extensor digiti minimi, and we have the extensor carpi ulnaris. Now, if we go deep to that, we will actually find the belly of the extensor indicus, and following this tendon, this is the belly of the flexor pollicis longus. All right, next up, we're gonna go ahead and identify the muscles of the lower extremity. So we're gonna go ahead and start with the anterior compartment. The anterior compartment is pretty straightforward. It's known as the quadriceps. So you guys have probably heard of the term quadriceps before. So remember, quad means four. So there's gonna be four major muscles in here. So first up, we got our rectus femoris. It's gonna be right on top, really prominent. You're able to pull this off of the cadaver, or not necessarily pull it off the cadaver. You're able to like pull it up on the cadaver, so you can see right underneath it. We got our vastus lateralis, which is on the lateral side. Our vastus intermedius, which is right in between our two quadriceps muscles, and our vastus medialis, which is on the medial side. So it's pretty straightforward and really easy to remember all the quadriceps muscles, and they all insert into a common insertion at the quadriceps tendon. The quadriceps tendon will then connect to the patella. The patella connects to the patellar ligament, which will connect to the tibial tuberosity on the front side of the tibia. So all in all, the quadriceps kind of insert into the patella, the quadriceps tendon, inserting onto the tibia eventually. Next up, we have our adductor compartment. Well, first up, let's go ahead and get the sartorius out of the way. This is our sartorius. It's crossing over. Just remember, sartorius. Just like a Roman general or anything like that. Go ahead and remove that guy. Sartorius, goodbye. Now we have our medial compartment. So our medial compartment are all the adductor muscles. So first up, we have our gracilis right along here. Just removed it. We have our adductor longus. Our adductor longus is going to be pretty prominent right along here. We can go ahead and remove that as well. Right beneath our adductor longus, whenever we've got a longus muscle, typically we have an adductor brevis, our brevis muscle. We have our adductor brevis. And this large muscle that's kind of expanding behind that is known as our adductor magnus. So it's a huge muscle, magnus, think like huge. We also have our pectineus muscle right up here. It's part of the floor of the femoral triangle. And we also have our iliacus, which is in the iliac fossa, and the psoas major. And combined, they actually form the iliopsoas muscle coming down. All right, working on the posterior now. Right off the bat, we got our gluteus maximus. It's a pretty easily identified muscle. Most of you guys should know this right off the bat. We have deep to this, we have our gluteus medius along the side over here. We also have our tensor fascia lata. On the cadaver, realistically, it'll actually be deep to the iliotibial tract, the IT band for short. Tensor fascia lata will actually have like its own little pocket kind of inserted in there. But like I said, tensor fascia lata, gluteus medius. Next up, some of the smaller muscles along here. So going from superior to inferior is the easiest way to memorize these. It's the piriformis, the gemellus superior, the obturator internus, the gemellus inferior, and the quadratus femoris. Now removing the gluteus medius, if it would wiggle off for me. So is actually our gluteus minimus. So we have a gluteus maximus, a gluteus medius, and a gluteus minimus. All right, perfect. So now we're gonna go ahead and take a look at the posterior leg muscles. So first off, right off the bat, on the lateral side, always gonna be on the lateral side, we're gonna have a biceps femoris. So biceps, two-headed, just like we talked about on the brachialis, biceps brachial, brachii. Our biceps femoris is just referring to the femoral region, kind of like the femur, where the femur is located. So right on top is our short head of the biceps femoris. Underneath, it's gonna be our long head, the biceps femoris. Now on this side, right on top, we have our semi-tendinous, and beneath it, we have our semi-membranous. I can tell it's a semi-tendinous by looking at its insertion point, which is along the pes. So the pes is a general insertion point of 3 different muscles: our sartorius, our gracilis, and our semi-tendinous. And the easiest way to remember this is to say grace before T. Say, which is sartorius, grace, which is gracilis, and then before, that's just kind of to make the saying sound better. T, semi-tendinous, the T in semi-tendinous. Now if we remove that as well, we still got some muscle back here. This is actually our adductor magnus. Our adductor magnus is actually part of the adductor muscle group, as well as the posterior muscle group as well. Down here is our triceps surae, which is along the calf muscle. Our triceps surae, they all insert into the calcaneus. They got the same calcaneus insertion. Right out the bat, we have our gastrocnemius, which is right on top. If we go ahead and remove that, beneath it we have a soleus, which is like much deeper. This is still part of our gastrocnemius. The soleus is starting right beneath that. And our plantaris muscle is not identifiable at the moment on here. But those are our 3 muscles, is our gastrocnemius, our soleus, and our plantaris. All right, so now looking at the anterior leg muscles. Straight off the bat, we have our tibialis anterior muscle. We have our extensor digitorum muscle. And if I go ahead and remove this, on the back side, we can actually see the extensor hallucis longus muscle. Coming right along here, we have our peroneus longus muscle, number 32, kind of stretching along here. This is also known as the fibularis muscle, fibularis longus. And we have our peroneus brevis, or our fibularis brevis muscle. All right, next up, we got the deep muscles of the back of the leg. Now, we have the tibialis posterior, number 42, kind of heading in this direction. We have our flexor hallucis longus. We have our flexor digitorum longus. And the final muscle is the flexor digitorum brevis on the bottom of the foot, right along here.